COVID-19 Mental Health and Wellness Program. Tonight's workshop is entitled COVID and You, Health and Wellness, and this will provide a brief examination of the physical, mental, emotional, structural, and spiritual effects of COVID-19. We're encouraging you to share your personal experiences for growth and healing. This series of workshops is brought to you by RER Consulting Enterprise, Barry University, New Horizons Community Health Center, and Miami-Dade County. The program's objective is to assist Miami-Dade County residents in navigating the myriad of challenges during and post the COVID-19 pandemic, with an emphasis on the wide spectrum of mental health related issues associated with disasters and pandemics. If at any time you have questions or comments, please feel free to utilize the Q&A feature on the lower part of your screen, or if you're streaming via Facebook, drop your questions below or on the My Mental Miami page. Thank you so much for being with us. My name is Dr. Tissa McGee, and I've devoted my life's work towards improving the quality of life in many urban communities. I'm an associate professor at Barry University School of Social Work, and since the fall of 2010, I've been teaching trauma-informed social work practice, social systems, research, leadership, and public policy courses. I'm also one of the leads of the innovative Promoting Wellness in Marginalized Communities program, which is an initiative under the school's Center for Human Rights and Social Justice. At the core of my work, I help to build communities in engaging and empowerment techniques. I would love to introduce my co-facilitator for tonight, Dr. Maria Tehan.
Thank you, Tissa. I really appreciate it. Good evening, everyone. As Tissa said, my name is Dr. Maria Tehan, and I'm a licensed clinical social worker and the Associate Dean at Barry University School of Social Work. My research and practice revolves around end-of-life issues, bereavement, traumatic grief and loss, crisis response, health disparities, and work with first responders. Dr. McGee and I are really honored to be with you once again tonight. We hope that it is a way to join our community towards a path of wellness during this time of COVID. So why don't we get together a little bit and let me share my screen here. We have a little bit of a PowerPoint to help along with our discussion. Today's agenda is we're going to talk about the multi-dimensions of the COVID experience with each of our communities. We're going to begin talking with the physical and elements of wellness, the mental and emotional elements of COVID, the spiritual elements, and then we're also going to spend some time on coping strategies. What can we do to help ourselves and each other as we move through this continuing journey of the pandemic? And as Dr. McGee mentioned, we also hope that you will move forward some of your own stories through the Q&A portion of the Zoom, and we'd love to hear from you, questions, stories, comments, and narratives. So with that, I'm going to bring that back to Dr. McGee, and she'll get us started on the physical wellness elements.
Awesome. You do have some slides on physical wellness, but I want to share just, last week we talked a little bit about how stress and our emotional health is so important during this time. And so I wanted to kind of just connect us back to that point. And when we start to think about our physical health, one of the questions and things that we discussed last week was the fact that the stress of our, that we are encountering during this time can also impact us physically. And that means that maybe we aren't eating as well as we normally would because we, are at home and we have access to our refrigerators at all times of the day and night. And so I don't know about you, but it's been kind of hard for me to kind of just even focus in, and you tend to, create bad habits in terms of how you eat. So eating can be one of the issues that people tend to see during this time. Also, sleeping habits can be impacted by our levels of stress and the things that we're thinking about. So also another thing that I deal with specifically not being able to sleep at night Sometimes you're worrying about things, or you're thinking about your family members, and you're concerned with how they're doing, and not being able to visit with them and see them. And that can create some long-term impacts if you're not sleeping well. And then finally, I think some of the other concerns that people have just are overall their safety. If they have to go out, or if they have to be in an environment where they're going back to work, or they're taking their kids to school, what's the safety measures and precautions that can impact us physically if we don't have hand sanitizer or mask or things like that? We have to be very much more conscious of our physical environment now than maybe you were previously. So all of those physical things can really impact you. And I think it's a balancing act you have between your mental health and your physical health.
I agree completely. And I think one of the important elements that I think it's important for us as a message to our community in terms of how do we assess where we are in this process,
Right.
is trying to understand the baseline, right? So where did we start from, and where are we now? And where is that difference between pre-COVID and now living in COVID? And I think that's part of when you try to look at yourself and you reflect, so it's the problem for me, then I think one of those questions that we should ask ourselves is that, where did we start? What is different now that wasn't there before? And I think sometimes people may not realize that in terms of the continuum of the physical issues or the physical demands on our body in terms of the pandemic and dealing with it from a multi-system process, is that you may be on either end of the bar, right? So you may be eating too much or not eating enough. You may be sleeping too much or not sleeping enough.
That may be also impacting something that we'll talk about later, which is our coping strategies, because a lot of people may exercise as a coping strategy. And with the pandemic came, the inability to actually do maybe some of the activities that you would normally be able to do. And so that could have an impact on your physical health. But we can't sustain some of these maybe negative habits that we've picked up during this time because lack of sleep, not eating well, being ultra concerned for safety at all times just is also very exhausting. And so people have to think about that and consider that, where they are in that spectrum as well.
Absolutely. And I also want to bring up, Tissa, I wonder what you think about this, is the importance, although we're not medical doctors, I do think, I think it's important to talk a little bit about the actual symptoms that might be occurring in terms of making sure that people are aware of symptoms that might reflect perhaps COVID or flu symptoms and so forth. And again, the message is making sure they're communicating with their medical doctors. And if they have any question that there might be some concern whether or not they were exposed, that they immediately communicate with their medical doctors in order to determine their care.
I'm glad you mentioned that, because that's also been a concern as people have maybe less access or been trying to access through telehealth type methods to their, their physicians, their mental health facilities. All of those things may also be impacted by, your ability to access those things. So good point, good point.
Yeah, and I think what you said is really important, this terms of access, which I think also kind of creates this emotional response. But part of, I think, our struggle during this time is that our normal resources in our community, whether they were easily accessed or not, and certainly we know that disparities exist, especially in our marginalized communities, that the resources may themselves have been impacted. So doctors were not seeing patients.
Right.
There was a lot of telehealth, but I think in especially certain populations, for example, our elders, were not as either didn't have access to computers or were not as comfortable or technology
Right.
savvy than perhaps our younger population. And therefore, I think it really disrupted not only impact or physical manifestations of the actual COVID, but also I think it led to people not seeking intervention or medical attention to chronic illnesses and pre-existing conditions that they had prior to COVID. I know
Right.
the research is showing that there's been then some concern that that will create in the future some chronic illnesses if people now are not, continuing to get support simply because they're concerned about going into their doctor's office.
So the next slide where you talk about mental and emotional, I don't know if you want to pull that up, but we
Yeah,
talked
let
about
me-
specifically the roles and responsibilities that we have and how those things can also be impacted by our mental health.
So yeah, I was doing some reading the other day, and I was shocked to find out that nearly 45% of people in the United States have reported increased anxiety and depression and an impact to their mental health during this pandemic. And so what this slide is looking at are some of the aspects of what that means. We certainly know that COVID has impacted how our worldview, how we perceived ourselves, our roles, and we'll talk a little bit more about that in a few minutes. But all the different roles that we had, it's obviously impacted our employment, being in the classroom as teachers, as educators, being familial roles changing. So for example, maybe the main breadwinner of the family has now been furloughed or has lost employment, and therefore the other caretaker or the other spouse may now have to go to work. Taking care of children, because now schools were disrupted, especially in the beginning. I know now that obviously some schools have returned back to the classroom or have left the option to the parents to make that decision and the caretakers. But I know that with some of the clients I saw during this time, one of their major stressors was having to juggle the anxiety and stress of not only bringing in their work into their home, but bringing in the classroom and taking care of their children and feeling so fragmented in terms of all the responsibilities they had. And I asked her if I could tell this story, but I know that even one of our part-time faculty shared with me that she had to go into the bathroom just to have 5 minutes to herself because her children were, constantly around her, and she wasn't even able to have 5 minutes just to kind of, chill out, and
Right.
felt such responsibility for taking care of them, taking care of the home, teaching, and all the other responsibilities that most of us have, and just in terms of our home life and so forth. So I think in terms of our impact to our worldview, the impact of the changes that we had to deal with, the impact on family and the roles and their schedules, including the parenting, including schooling, caregiving for those of us who have had to be responsible for caring for our elderly parents or ill family members and so forth. I think that was also another huge isolative kind of experience where there's certain, I think, populations, and I think caregivers are one of the most isolated populations in our community in terms of access to support and resources. And there was further isolation for this particular group during the pandemic that created a lot of stress, which then of course created anxiety and depression and these feelings of hopelessness and helplessness. I'm going to stop sharing here so you and I can talk a little bit about this.
No, I think that story that you shared is very familiar. Like I've heard friends and just overall people talking about this fact that multiple roles that you have to have as you know, as a mother, a wife, you know, a daughter, it's all of these things coming together, and your world's having to have, you know, all of that at one time sometimes can be very overwhelming, can lead to more and additional stress, and
Yes.
can create this sense of, I think we talked about last week, a little bit of hopelessness, because
Yes.
you don't believe you can handle it all, because, you know, it just is coming back to back to back. So it's important for us to acknowledge that,
Mhm.
to see that those are issues that that we're not alone in facing.
Exactly. And I do want to bring some numbers forward, not to add to our anxiety, but I think it's important to be informed, which in fact, I think is foundational to what we're doing here today, which is informing our community, informing each other so that we then can respond instead of reacting and then feeling more fragmented than we've been. So just in terms of numbers, which really was surprising to me, that during this time, I believe that 1 in 3 people in the United States reported that they had some serious episodes of anxiety and depression. And of that, about 13% actually reported suicide attempts. And certainly substance use also increasing during this time, all connected to this idea of social isolation, sheltering in place. And although we knew at some level of our understanding of this pandemic that this was the safest thing we could do, shelter in place, isolate, wear a mask, and so forth. I think, well, like we talked about last week, humans are inherently, you know, hardwired for
Right.
connection, and
Yes.
that's disrupted. I think in the beginning, I know people, I know I did, almost took it as, wow, I can stay at home. This is great. You know, I can work from home. It almost was unreal because I don't think we understood
Yeah.
that this path could last as long as it did.
We've never experienced anything like this
Yeah,
before, so we didn't have
exactly.
anything to relate it to, or even to compare in terms of how do you deal with this, right? Because it's not comparable to anything that we've experienced in our lifetime. Um,
Absolutely.
Even though when we will talk about grief and loss next week, um, it's an enormous
Mhm.
undertaking to try to understand, you know, what people are experiencing. I think that everything that you've mentioned already is impactful. We've talked about physical, we've talked about emotional. Um, a big chunk of our own personalities and our experiences in our lives is employment. What do we do for a living? Where do we go to work? How has that been impacted by the shutting down of our community, by the, you know, the changes in our employment statuses? I mean, it's so much. I mean, this concept of frontline workers, you know, never did I consider, you know, nurses and doctors and all of the things that they do, the importance of that, just, it jumped like 100% in my mind, you know?
Yeah, I agree. I think that one of the things that was really brought forward in terms of the pandemic was this disruption in everyone's employment. And I believe that at its highest, unemployment rose to about 14% in the United States. I think now it's a little closer to about 10. And I think in Miami-Dade in Florida, it's a little over 7% unemployment. So, you know, thankfully it's been improving through the months. But the numbers, as we talked last week, I don't think the numbers, you know, we present the numbers to kind of show that there's evidence towards this change in worldview that we all have had, not just in terms of our community, but globally. But what those numbers really represent, I think, and I know you would agree with this, is change in people's lives.
Yes.
And not having a stable environment of income coming in obviously disrupts everything that an individual, has. It
Right.
disrupts safe environment, housing. It can disrupt if you do have a job, or some kind of job if you have been impacted. I know a lot of agencies and corporations, and trying to not furlough their workforce, have cut down on their salaries. And so people had to renegotiate what they were going to pay and when.
So, and that impacts your financial health and well-being impacts everything else around you. You have your, people have to pay rent and they have to buy groceries. I volunteered for some of the food giveaways, and I was just astounded by the amount of need that we have in our community, but the idea that people really, had to be creative and think about other ways in which they could help to carry if they weren't employed, or if they lost their jobs, or if they had to go out, and do their jobs in a frontline type of capacity and put their lives at risk, and possibly their families' lives at risk, because they're, having to bring that back to their home or to, wherever they are. And that's just, it is something that really, again, has a long-term impact on your mental health and your ability to cope with this.
So I think we're seeing this theme, even though we've attempted to separate into our discussion for the sake of our discussion. We've separated elements of physical wellness, mental and emotional, employment and spiritual and so forth. I think, what we see threading through this is this interconnectedness, this intersectionality of all of these elements and how they impact our human condition. Because it's my personal belief, and I know Tissa, from obviously being a colleague, that you share this this value and this idea of the mind and body and spirit connection. And so when we talk about how COVID has impacted ourselves and our community, you can't separate this kind of trifecta of criteria that we're experiencing.
Right.
And so in terms of when we talk about employment, I do want to bring, we've kind of discussed it a little bit earlier in terms of the mental and emotional aspect of it. But again, part of this change in worldview was bringing the work home. And, I know that as I was growing up, so to speak, in my professional life, it was kind of drummed into me, you keep your work at work, you separate that, you compartmentalize it, you don't bring your home life into your work life, and you have to, in order to create this professional persona, you need to be able to separate that. And lo and behold, the pandemic comes, and those boundaries are totally broken away. And not only are the boundaries broken, but work is literally in your home now. And I know that has been a tremendous disruption for people. And how do you have a sense of creating boundaries when you literally are working from home? People are seeing your home, people are coming into your home.
Right.
And there's this kind of weird virtual reality of breaking through those boundaries. And I think trying to still maintain some kind of professional separation, but also separation in order to be able to refuel ourselves. And we'll talk a little bit more about that when we go into coping strategies. But I'm a firm believer through a crisis, trying to set some kind of structure in order to move through it. Scheduling and so forth is really a helpful process. But I know that from the people I've worked with during these last 7, 8 months now, one of the biggest impact for them, as they shared with me, certainly the anxiety of whether or not the actual income was impacted, but also how do you wade through this idea that now work is in your home and you have all these different balls that you have to juggle in terms of work, school, if you have a child in school, whatever, and of course your family life. So I think that those three things kind of intersect, and it's a continued anxiety and depression.
I'm happy you talked about the sort of trends and what we're seeing across the board in terms of all of these issues. Um, there are additional challenges, like if those weren't enough, there are other things that we wanted to just bring and highlight. I think that this summer, really made some of just overall the disparities that we see in our different communities come to the forefront of our discussions, come to the forefront of our experience. And so that was also like a different uh, thing. We saw advocates and community advocates, people actually working towards expanding the knowledge, expanding what people know about our experiences in our communities. You know, under the microscope of these really sort of negative images that we were seeing coming out of things like the what happened to George Floyd, to Breonna Taylor, those disparities in our communities were being felt, and they were real, and people wanted to also be able to express themselves in that context. But I want to kind of even take it to like another spin off of that, is that we realize that there are a lot of different types of disparities in our communities. Health being one of them, right, is when we talk about COVID-19 and how this impacts specifically African-American communities, communities of color, where they particularly may not have had the opportunity to have good healthcare prior to COVID, like what you were saying earlier, our pre-COVID and our in the middle of and post-COVID. But those disparities possibly led to things that may give them even higher risk levels for COVID-19. And that could be anything from diabetes to high blood pressure to things that in our communities of color have been traditionally not dealt with, not really people not being educated on how to take care of themselves properly and to get the kind of care that they need in order to live with that. So those health disparities kind of like even blew up as the same thing as our community disparities kind of being highlighted. Now we also saw these health disparities come to light. And so I think that is part of this discussion needs to be about how do we continue to make our communities be able to help themselves through that. So those pre-existing issues and concerns around our physical health and our mental health have increased, definitely. I see that there are issues that we are because we are isolating, maybe even at higher levels, right? So things like domestic violence, things like mental health and mental illness, and what you talked about earlier, suicide, right? Those risk factors also engaged and got higher and higher. And so one of the things we have to think about, the ways in which people are in their own environments, is it higher because they are having that ongoing exposure, substance abuse and relationship issues, and not having an outlet. I think to me, that's what I heard most often around people not having an outlet, a space that they could maybe, separate and get away from some of those factors that are, potentially what we're terming additional challenges, right? But can be a part of everyday life.
Yeah, I have to agree. I think you stated that so eloquently. And, in terms of intimate partner violence, one of the things that I found interesting is that in the beginning of the pandemic, I was reading that crisis lines around the country actually had a 50% drop in calls. And I wondered why that was. And as I continued to do some research, because of these disparity issues in terms of not having the resources available. So one of the reasons that was stated is that simply there was no safe outlet in order to be able to make those calls, because of course the perpetrator or the individual was there in the home. Whereas before, there might have been an opening where someone, let's say that the individual that is perpetrating the intimate partner violence was in the home for work or whatever. Now everyone is encapsulated in the home and there is no safety outlet in terms of being able to make those calls. However, that has of course shifted, and through these last several months globally, they've seen a 50% increase in intimate partner violence reporting. And of course, as you mentioned, Tissa, disproportionately in communities of color and other marginalized groups for some of the things that we know existed pre-COVID in terms of economic instability, safe housing, neighborhood violence, and certainly the ability to have the resources for stable childcare or social support. So all those issues are certainly coming forward, and substance use, as you mentioned, being used as a way of managing stress. So I there's been an increase in that, in what we've seen in terms of substance use and abuse, because it's been a means of managing people's stress when they aren't sure what those healthy and optimal level of coping strategies should be. Unfortunately, some people have moved into substances, alcohol, and even tobacco. And so those are some things that have certainly come forward. And as you mentioned earlier, also things like overeating or stressing, not taking care of oneself. So those issues certainly have created, as we said, additional challenges. And life does not stop because pandemic happened. So in terms of additional issues, things like normal relationship things happening, as you said, divorces, and even happy things, marriages, all of these things. My own daughter was supposed to get married in May, and her marriage had to be postponed. We were all going to have a family wedding in Italy. And so here's a positive, wonderful transition in a young person's life, but it created a lot of stressors for us as well, because of course it wasn't able to be met. So when we talk about normal life responsibilities influencing our response to COVID and relationship issues, it isn't just necessarily negative things that might happen, but all the wonderful things that were not able to be shared. Children having babies and birthing and marriages and a lot, and graduation. How many
for our students,
right, couldn't go to graduation. So
it's definitely had an impact. One of the other things this project is doing, Maria, and I want to make sure that people hear about this, is that we have a great survey that's on mymentalhealthmiami.com that is gathering information about what are some of the needs and experiences of residents in Miami-Dade County, and how they can give us some of their, share some of their background with us and their information, so that we can make sure that the proper resources are available to our county residents. And this is one of the brilliant things I think about this programming. Not only are we getting to share and hopefully give some resources to our communities, but also to get some information so that we could be better prepared and do a better job at getting those resources to them. So I hope
do.
people will log in
Yeah.
and check that out.
I do encourage people to do that because then they get a scorecard. I believe the scorecard is sent to them and they have a sense of just exactly where they are and some opportunities for enhancement and healing.
Yeah, and it's a really brief, it's brief. It says it's not a
Yeah,
long survey. So I know sometimes
exactly.
we ask people to take surveys and they're very long, but this is a very brief one and it does hopefully again provide us with the right information.
So
So
when we talk about healing, why don't we go into our next aspect? And it's something that I don't think we talk a lot about anymore, but when we mention that trifecta about the mind, body, and spirit, I think it's important to bring in spiritual influence of responding to COVID. And I think I'd like to bring first the idea of spiritual pain, because as a grief counselor, I always feel it's important that we acknowledge the pain. We can talk about healing, and I believe in it. I believe in healing. I believe that people are inherently resilient. But I think that in that discussion, people often try to avoid the discussion of the actual pain, because knowing that we're moving into healing doesn't mean that the journey is any easier. And so I want to first acknowledge that during this time, there's many people, especially those of us who may have a connection to a faith tradition or spirituality, or a sense of a power higher than ourselves, a divinity, if you will. I'm not necessarily speaking about religion as opposed to a sense of faith or a sense of spirituality. And for some people, it may, this struggle with all the elements that we've been talking about under the umbrella of COVID could have created a sense of spiritual pain or a conflict with God or whomever they believe as a higher power. And interestingly enough, a report from Columbia and Duke University found that people who have experienced this kind of dissonance or conflict with their intrinsic spirituality actually have found that there's a correlation with higher mortality rate and actually higher chronic illness and heart conditions and so forth. And conversely, then spirituality also has been found, especially during this time of the pandemic, as a protective factor. So again, in the continuum of wellness that we talk about this path of wellness. There's this acknowledgement of the pain we're experiencing, the idea that if you do have a connection to your spiritual self, there's an acknowledgement that you're wondering, why is this happening? How could a God that, supposedly all loving, allow this to occur? And then as you move through this healing process, being connected to this idea that what we have found, that a belief in a higher power, belief in something higher than yourself. And it may not necessarily be something that we might call divine, but it might be a belief that the human condition can improve, a belief that things will get better, a belief that there's an inherent optimism to our existence.
can I share one thing?
Factor. Sure.
Yeah. What I wanted to say is that I'm happy that we a lot of our faith community transitioned to a virtual community, and people were able to make those connections. And in some cases, I think they're even more connected than maybe if they had to go to a physical location. And in other ways, people feel disconnected because they don't have that, the ability to see Their faith family, once a week was something that they looked forward to, and that brought them pleasure, and that gave them, comfort, right? And so, although we were able to transition, and there's a lot of great opportunities to connect with faith communities virtually, I still think that there's something about, being physically there that people really, that was part of what that resonated with them as part of their faith. We do have a question about this, so while you're thinking about that, I'm going to read you the question really quickly.
Okay.
It's asking, someone is asking, can we provide some ways to acknowledge spiritual pain without feeling that they have to become the pain or let the pain overwhelm their entire experience? And I guess in that spiritual realm that we've been talking about.
So I don't know how you feel, but let me perhaps answer perhaps in a way that's unexpected. And that is, I'm a firm believer that in order to move into the healing, you have to lean into the
pain.
So I think when we talk about, acknowledging it or not becoming the pain, it's not that you want the pain to overwhelm you, whether it's spiritual or otherwise, but I do believe there's a sense of leaning into it and what is now being called radical acceptance. So this sense of radical acceptance to the reality that we're in, and then moving through it and believing that there is hope. I think that regardless of what we know, and I find this fascinating, especially in terms of our role as clinical social workers, Tissa, this idea that what we have found is most successful in terms of therapy and healing and mental health, the wellness, is this awareness and a thread that is strong of connecting people to hope.
Right.
That hope that things will get better. You not only can survive, but you can thrive. This too shall pass. So I do want to shift that question or that comment a little different, in that I do believe in leaning into it. I do believe in immersing ourselves in that awareness of the pain, so we then can move into it.
So how would you help that person to acknowledge that? So that's what you're saying, is that they have to really, okay, so the question was kind of like, what are some ways in which they can acknowledge that spiritual pain? Is there something that they can do specifically?
So I guess we can talk about, as we move into the wellness part of it, or the coping strategy part of it. So yeah, let me talk about that, and let me just share that.
Can I tell folks too, they can also, again, put your questions into the Q&A or post them on Facebook, so that we can try to get those answered within the context of what we're talking about in terms of the wellness part. That would be great. Or if people want to share stories, right? We want to make sure that they know that they can. This is the space.
So let me just start. Here's a little slide that we kind of put together about some of the things that we can do in terms of coping and managing crisis. And we did want to, again, encourage everyone to move into the understanding of making sure that they're taking care of themselves physically, because regardless of what other aspects of our work or of our dimension, our human dimension, whether it's spiritual, mental health, emotional, if we don't take care of our physical selves first, our physical safety and so forth, everything else just isn't going to, just kind of then is a snowball effect. So again, we encourage you in terms of wellness and coping. Make sure you're wearing your mask when you're out, keeping physical distance, contacting your healthcare provider if you're concerned, especially. But now let me move into this idea of acknowledging your spiritual pain, and then what can you do? So I think that one of the things that I might make some sense in terms of reaching out to whomever you value, and it could be a priest, it could be someone, if you belong to a mosque or a synagogue, we encourage you to reach out to your spiritual leader, whomever that may be, because obviously that individual and your faith community can definitely be a way to continue to connect and move through that pain and understanding. For people who follow a certain, for example, people who follow a Christian perspective, you may find healing in reading your Bible or reading passages from that. And for people of Muslim values and faith traditions, you might choose to read the Quran. For those of you who might be more of the spiritual perspective or non-denominational, you might find healing in reading affirmations and books with poems and so on and so forth that connect you to something beyond, yourself. Also, in terms of this idea of beyond yourself, I know that, and I think it's important that we know that one of the most healing things we can do in terms of moving through a crisis is being aware that others may need us. And so volunteering and moving us away as much as, again, as it's safe, if you have an opportunity to volunteer at your church, at your synagogue, at your mosque, at your local community center, those are some of the things that can help not only with the other aspects that we talked about, but certainly with our spiritual pain. Practicing mindfulness and breathing. We talk a lot about, for those of you who might be interested in yoga, exercise, moving, walking, one of the things we know is that trauma stays in the body. And so getting it out of the body in some way is really one of the most effective ways that we can take that kind of cup of stress and start pouring it out so that we're in control of it.
And
So,
that relates.
Go ahead.
That relates right back to how we started this conversation about our physical health, right? And if you're feeling that overwhelming feeling and that tense stress in your body, you definitely want to do those things that might help you out physically, right? So actually going outside, getting away from,
Yeah.
I love how you put in there limit media and social media because we're also attached to our phones and to the television or to all of this data and information that's constantly coming at us, that to even put some boundaries around those things, I think is really an important piece that maybe people don't talk about enough, because like, again, you go to bed at night and the last thing you're doing is looking at your phone, and then you're waking up and you're looking at your phone. And so
it's one of the big ironies, I think, of this journey, because technology was the way we got to stay together, right? It was a way to stay connected. But here we are, 7-8 months later, and we're all are suffering from Zoom fatigue, quarantine fatigue, COVID fatigue, whatever we call it. And if we have to look at our
so we're grateful for you, those of you who are logged on and are listening to us on Facebook and
exactly
Zoom today, because it can be overwhelming. And so boundaries, I think, is a good thing. One of the last bullets that you have on there too is setting some structure in your home life and maybe even distancing that from your work life. I know you said, as we're working from home, that sometimes that line can get blurred a little bit, but there is something to be said about this ability to say, okay, this is the times that I'm going to work, And then I'm going to disconnect from that and connect
Yeah.
to my home and family life. And this is the time, you know, that I'm going to dedicate to that. So
And if possible, I mean, also very practical and application of that is, if possible, have a space in the house where you know that's where your work is. So I realized very early on that I felt like I was at work 24/7 wherever I went into my house.
right.
And so I thought, wait a minute, you know, I need to practice what I preach.
Mm,
I took my desk. I have a little desk, you know, in my little like little foyer, and I made that my work, you know,
area.
environment. So I knew that the minute I sat there, that I was on, so to speak, and then when I left, I was back with my family and back to my private life. And I have to say, just doing that small thing really helped me, because it kind of boxed me in to give me some boundaries that we talked about earlier, because I knew that that is where I could work. And you know, for me, I was lucky. I had this little space and in my little entryway. But for some, it might be your bedroom, you know, and I'm not kidding. I've heard people say that, you know, they go into their bathroom because it's their only way where they can kind
Yeah,
of, you know, get away from the rest of the family.
right.
I do encourage you, aside from some of the more emotional things that we've talked about, really creating some boundaries or some real application to setting those limits
Mm.
as much as possible and realistic in the house as well.
You know what I'm looking forward to, and that is module 4, where we go a deep dive into some of these some of the strategies you
Mhm.
talked about, because that's when we talk about the toolkit, right? And
Yep.
so you got to keep coming back for and tuning into our modules, because this is, I think, some great information. And even if you don't catch it right when it comes on at 5:30 on Thursday afternoons, you can always share this, right? You can share this as a link. You can go to the My Mental Health Miami website, and you'll get the links there to the YouTube channel that this is on as well. So please, please, please feel free to do that. And you want to share some of the resources that we had talked about too, posting?
Yeah, I just wanted to make sure there's a list, and the PowerPoint and our presentation today is going to be on the website as well. So I just wanted to share that we did put together some resources that you can connect with in our community in terms of mental health support, housing, testing sites, and so forth. And again, going back to our website in terms of mymentalhealthmiami.com as well. So we wanted to mention that we did put together some resources for you. And
Go back one slide. Go back one slide real
oh,
quick.
okay.
I want to make sure we do a big shout out to Miami-Dade County,
Yeah,
right? Because they,
yeah,
as one of the sponsors too, they have a lot of information and
absolutely.
resources that
Yeah.
that is going
I
to
have
be
a great
our,
dashboard there in terms of numbers and so forth, if that's something that you want to keep up with as well.
absolutely.
And then, of course, as always, we want to make sure that everybody is staying safe, keeping their distance, staying connected. Remember, through this whole thing, as difficult that has been, I think we ended last week with the idea of the power of our human heart and soul to survive and thrive. And so I think I want to really reiterate that in terms of resiliency, staying connected with your community, whatever that community is, big or small, and know that together we can move through this, and we will get through it. And just thanking everyone again for your participation and having and giving us the honor of walking this with you. And hopefully together we can learn from each other. And we hope to see you next week, which is going to be on grief and loss aspects of all of this.
Yeah, I think that's going to also be a great discussion because as we prepare, there's been so many things, like you mentioned, some good things that potentially could have happened in our lives, and then, maybe not losing the opportunity to have those things happen. People feel really concerned about that, losing their loved ones, or just their ability to access all of those things. So I'm also grateful that we've been here, and I thank people for putting in their questions and logging onto Facebook and being live with us. It is an important discussion. It's important for our communities to have this and to realize that this is something that we are learning how to get through together. And I do value your knowledge and experience, Maria, in working in the field and working clinically with so many people, and sharing that that experience with us on this platform. And I thank all of our sponsors again: RER Consulting, New Horizons, Barry University, of course, and Miami-Dade County. So thank you so much for being with us today and making sure that we have these discussions and prepare our communities for more knowledge and experience about COVID-19.
Thank you. Good night, everyone. Thank you.